This is a demonstration of C0-C1 assessment and a seated C0-C1 manipulation. When utilizing kinetics therapy, we always want to consider the kinetic chain links and the possible joints that may be restricted. And this is an area that is commonly restricted in many of our patients. So for our assessment, our patient will be seated, and we will start with the cervical spine, upper cervical spine retracted a little bit. We'll place our hands on top of the head, directly behind our patient, and we will isolate the lateral flexion to the top of the cervical spine and just bring the nose just back towards the midline that it came off, and then apply overpressure to assess ipsilateral lateral flexion, contralateral rotation, and anterior sagittal glide, which is the normal coupled movement in that region. We will reverse directions and compare it to the other side. Start with some retraction, lateral flexion to the top, nose just back to the midline, and then overpressure applied to sense how much give is there. All right. For this demonstration, there was less movement going to the right, so that's the direction we'll actually perform the manipulation in. All right. So I'm going to stand opposite the side of my contact. My middle finger is going to make the contact along the occiput, and the patient's head will be rotated to the opposite side. All right. The head is laterally flexed over the contact, and the contact is comfortable and light at this point. The thenar is resting on the mandible, but the middle finger is also on the occiput, so everything is connected, so the patient should not perceive any pressure on the jaw. The head is held in that position, and the patient can be instructed to hold their head there. Go ahead and hold your head in this position. And then the other hand is placed with the middle of the hand over the ear. The thumb is on the occiput, and the fingers are spread out over the remaining part of the face. A little bit of a lift is imparted, and the doctor and patient should be very, very relaxed and comfortable. The delivery is going to be an impulse type of thrust towards the doctor, all right, in this manner. So is it okay to demo that for you? Mm-hmm. And we're just going to bring that in just like that, and that's the adjustment.